there's no getting around it, right? Pain after ACL surgery is just part of the process. However, those who understand pain will understand when it's okay to confidently push into that pain and when they may need to perhaps dial things back a bit. But in order to understand those concepts, let's first talk about what pain means. Pain is an alarm that's sent through the nervous system when it perceives something to be dangerous. To understand how this chain of communication works, let's go through a very basic example. You put your hand on a hot stove. The nervous system senses the temperature of the surface and realizes that it is not safe. The nervous system immediately sounds the pain alarm. So then what causes pain after ACL surgery? Pain after ACL surgery occurs because a lot of trauma has just occurred in the knee. The nervous system becomes highly sensitive towards stress on the knee and typically decides that any stress on the knee is dangerous.
Danger, danger, danger.
With this perception of danger comes a more intense ringing of the pain alarm. If you hope to return to sport without pain after ACL surgery, you must convince the nervous system that placing stress on the knee is safe. So let's discuss some strategies then on how to interpret pain after ACL surgery. In order to convince the nervous system that it's no longer dangerous to place stress on the knee, you will need to gradually expose it to more and more stress over time. This becomes a bit of a balancing act though. You want to challenge the nervous system by introducing it to new stresses, but you don't want to overdo it, which could cause the nervous system to double down on its perception of danger and cause a setback.
It's true.
Here's a few simple, basic guidelines to follow to help interpret pain after ACL surgery. Pain levels at or below 3 out of 10 can generally be considered safe. Explore these pain levels more deeply though by continuing the activity. Be a little more cautious with sharp or stabbing pain. You may want to consult your physician or physical therapist to make sure it's safe to work through this type of pain.